Hello, welcome to Muthu Integrative. My name is Prashant Muthukrishnan. Thank you for joining me for this video. This is Introduction to Ayurveda in Respiratory Medicine. I am trying to record a podcast actually for American Thoracic Society, and I just wanted to test it out and share the content with you guys and see what you feel. So, what can I tell you about Ayurveda? Well, at the outset, in Sanskrit language, Ayur means life and Veda means knowledge or science. And therefore, Ayurveda means science of life. The origins of Ayurveda are more than 5,000 years old in the Indian subcontinent. And the earliest written documentations of the scientific concepts of Ayurveda that are available to us today include some works like Charaka Samhita, Sushruta Samhita, to name a few. Being in the USA, I certified myself with the help of a NAMA accredited program called Healthcare Professionals Ayurveda Counselor certification with Maharishi Ayurveda, MAPI. That's a collaborative effort with David Lynch Foundation and Maharishi's Transcendental Meditation Program. NAMA means National Ayurvedic Medical Association. The oral tradition of Ayurveda until 400 BC may have contributed to potential loss of important wisdom. However, the existing documentation of Ayurveda in the form of biochemical, microbiological, and practice-based clinical experience across generations and populations within the four Vedas, which are scriptures in Indian literature, that itself is vast and barely tapped. So many parallel systems, such as Chinese medicine, Arabic medicine, forms of indigenous medicine, even Greek medicine, they may have followed closely after Ayurveda, or some may have even coexisted with Ayurveda. And all of those ancient systems have given birth to what we practice today, which is modern medicine. Now, let me give you an example of Ayurveda from the patient's perspective. Let's take the case of this 40-year-old woman with BMI of 21 who comes to her medical doctor and complains of fatigue when she goes for running, and she also has mild hair fall. She has a variable appetite, has mild graying of hair, mild stress at work due to erratic evening shifts sometimes. She reports being type A personality, and she has some sleep issues. She tries eating healthy salads and fruits when possible. And at the exam, head and neck and cardiopulmonary exam is normal. Her blood work comes back normal for thyroid profile, CBC, CMP, hemoglobin A1C, pulmonary function test, breathing tests, EKG, and chest X-ray. So the physician recommends her to continue her healthy diet and exercise, reduce some stress if possible, and to reassess in 6 months with maybe endocrinology consult if needed. In the next visit, guess what? Symptoms persist. Normal TSH profile, but this time she has an isolated TPO, thyroid peroxidase antibody, mildly positive, and the PFT breathing test shows now a mild obstruction suggestive of asthma. Inhaler regimen was begun, and endocrinology wanted her to monitor her TSH levels every 6 months due to the potential risk for Hashimoto in autoimmune thyroiditis. Such patients will tell you that they don't feel all right, and please do something right now more than just reassessing in 6 months, right? And that's where Ayurveda is able to capture patterns of symptoms in stage 1 and 2 out of the 6 stages of disease per Ayurveda before full-blown clinical biomarker and laboratory evidence of disease manifests. Importantly, the much needed lifestyle and diet recommendations would be very personalized to her body type assessment or phenotype or humorism, called Vata in her case, available online as calculator in Chopra and other websites. The endocrine, hormonal, respiratory, airflow, circadian, hair fall, gray hair, psychiatric manifestation, behavioral symptoms, all of these of this patient are glaring at us. And all of them actually, guess what, stem from imbalance in a single modality called Vata. And answer is not to wait and watch until TSH becomes abnormal and then start thyroid supplements, but instead addressing her subtleties, like the dry cold salads that sometimes she eats, her BMI being very low is indeed a problem. Type A personality, her shift work, her exercise, maybe she's exercising more than what she needs to, right? So those are the things that we address in Ayurvedic perspective. Historically, such phenotype-based understanding of human pathophysiology was used later by Hippocrates in 400 BC as humorisms called sanguine, choleric, melancholic, and phlegmatic. You guys know this. Similarly, William Sheldon's ectomorph, mesomorph, and endomorph somatotypes are parallel concepts to humorisms and Ayurvedic phenotypes. And each of the three phenotypic machines in our body, called Vata, Pitta, and Kapha, give rise to a specific list of diseases, such as asthma, GERD, ILD, allergic rhinitis, sarcoidosis, and therapy is aimed here at restoring the specific machine's excess or deficiency, okay? So when a patient presents with a symptom localizing to the lungs, such as cough, mucus, shortness of breath, the Ayurvedic practitioner or counselor inquires into many other symptoms, review of systems, manifesting in other organs, and eventually formulates a whole body systemic diagnosis of the person, not the disease. This is what we call as whole systems management, and clinical trials in Ayurveda and Chinese medicine are commonly performed this way rather than a randomized control trial of a single therapy or a drug, right? Because one therapy or a change may not, get you the effect, because it's an entire system, a package of things that's going wrong. So comorbid diseases like asthma, seizures, headache, atrial fibrillation, endometriosis, and coronary disease, all of these arise actually from common pathways. And we need to recognize this. Ayurveda aims to control or eradicate disease centrally by fixing the VPK profile and not just peripheral symptoms. You go back home with a name for your body constitution type, dosha or prakriti, a predominant type of imbalance in your body constitution, which is Vikriti, and the type of balancing food or daily routines, spices, or professional recommendations. Yep, you heard me right. An integrative Ayurvedic counselor can make your workplace professional actions or routines synchronize with your body type so that you can create health in you and fix your disease. Don't you want to do that? Yeah. Now, the core of health rests in the gut, according to Ayurveda and modern microbiome research. Disease arises from imbalance in the 5 physiological forces resting in the gut and spreads over 6 stages of disease to other tissues and organs to manifest ultimately as chronic disease, like hypertension, diabetes, and so on. The most sensitive nervous system actually rests in the gut enteric nervous system. And that's why we say, I have a gut feeling before something goes wrong. The human microbiome responds and oscillates with our daily habits and with any disruptions to our schedule. Based on the circadian rhythm itself that goes about 26, 27 hours, there is a natural tendency for us to delay anything that we want to do, right? Based on our physiology. So the accumulation of such disrespect to the biological clock leads to dysbiosis, because these microbiome, they are so sensitive. If something has to happen in a particular time fashion, the microbiome appears. But then if you are not ready to respect that particular hour of the clock, then they get really, really dysregulated. So since lifestyle is the cause and lifestyle is the therapy, let's learn the details of what the biological clock is. Well, each cell and atom in our body and the universe around us runs on a software called biological intelligence or clock or consciousness. This is not the consciousness that you think when you close your eyes and meditate. This is not just that. There is literally consciousness in every atom that's in your body and the universe around that's running this universe. The software energy manifests as matter in the form of 5 natural forces that constitute our body and the universe, which is air, space, water, fire, and earth. Humans naturally deviate from maintaining discipline and the balance of these 5 forces in our body, and this gives rise to disease. Ayurveda supports this intelligence software as it attempts to bring back things into balance. When combined with modern medicine, Ayurveda brings forth a stronger control of both root cause as well as symptoms. believe me. Ayurveda first encourages supplements from nature rather than industrially manufactured or processed supplements. But we know that industries are required these days to run clinical trials. And so many industries like botanical industries, like the herbal industries and supplements industries are needed, and they are doing an amazing job. So it's best for us to collaborate. So Ayurveda first encourages supplements from nature, right? So the American College of Lifestyle Medicine, Institute of Functional Medicine, and other integrative medicine forums are striving hard to achieve a package for our patients and the public and physicians. Fortunately, pioneers like David Rakel of New Mexico, who came initially from Wisconsin, these guys are building a stronger curriculum for medical schools with courses in Ayurveda and other aspects of integrative medicine. So in these podcasts that I'm doing, we are trying to plant the seeds of Ayurveda concepts for physicians like you who've not been taught during medical school about the link between digestion, metabolism, habits, personality, and disease, including respiratory disease. We don't get good quality nutritional advice or education in our medical school. Nutrition in Ayurveda is not based on calories, carbohydrates, fats, proteins. No, it is based on the quality of the food and how it matches with your phenotype, the taste of the food, right? 6 tastes, and that's how we match your phenotype. For example, Kapha people or Vata people should not eat more Vata foods and Kapha foods. It should be opposite. For example, Vata people should eat more of Pitta and Kapha. For instance, Pitta people should eat more of Vata and Kapha. So it's balancing, right? So these topics are actually part of core science in some traditional middle and high school systems in India and Eastern world. Very soon, I expect integrative health science to be part of school curriculum globally. And these concepts have been and are being validated by current genomic and biochemical research studies in the US and world over. You can see it on PubMed. It's all over the place. You may ask me, does Ayurveda have branches or specializations? Yes, indeed. Ayurveda and other forms of ancient medicine actually laid the foundation for the specialization that we have today. 8 branches include internal medicine, surgery, ENT, medicine, OBGYN, pediatrics, psychology, and so on. And these are general practitioners that mostly are available in the community. And there are specialists also in Ayurveda. The majority of the impact, however, comes from the most basic and fundamental aspects of Ayurveda. And those things can be easily shared by the general practitioners. And however, only when the patient assimilates, contemplates on the knowledge gained, and executes it in reality daily. Ayurveda is a way of life, right? It's a lifestyle. It's an art that actually beautifully balances duties towards the biological clock and the desires that we have in professional and social life. Because usually desires take us away from duties. And that's where we balance, because that's how you get health. Here, I would like to refer the public to my YouTube, SoundCloud page, and my webpage, Muthu Integrative, for a host of resources and my publications in integrative Ayurveda and respiratory disease. Now let's talk about Ayurvedic terminologies, doshas, and nutrition concepts. The most important aspects of Ayurveda that allopathic physicians and public will benefit from are threefold. Number 1, prana, which is energy in Ayurveda, or chi in Chinese medicine. As echoed by Einstein's theory of E equals mc squared, this energy called prana comes from the universe around us. Most importantly, the sun and the moon, right? We are actually moving bodies of energy. We think we are matter. No, we are actually moving bodies of energy that's manifesting as matter. And we are a continuum with the environment, the universe. And so there's constant exchange of energy between human matter and the environment, and hence the importance of paying attention to the particular hour of the clock or the season of the year when you do certain things or when you eat certain foods. The energy comes from through all the 5 senses that we use to interact with the environment. For example, the prana energy of the fresh versus old food we may eat, the hot or the cold air, or the smoke we breathe, the horror scenes or adventurous scenes that we may watch on TV. These actually impact the energy that goes into our body. These energies get processed by human physiology to produce an ultimate product of processing or metabolism. And so the type of energy that we choose to get exposed to is very critical for our VPK, because they need to sync, right? If you are already an adventurous person, and if you want more adventure in life and you go more and more toward adventures, then there is a lot of vata, right? And therefore, that'll be an example of vata-based diseases. Now, this concept is actually synchronous with the positive energy techniques such as Reiki and acupuncture that maybe Tanya can relate, right? And right, the concept of energy flow is universal across many cultures, whether in the form of healing touch, commonly described among health professionals such as nursing, prana among yoga practitioners, Reiki in Japanese tradition, yin and yang in traditional Chinese practice, which refers to the energy balance within the physical body as well as the universe. Another concept that people may be familiar is actually feng shui, which refers to the art of object placement within the physical space inside your homes and office to facilitate positive energy flow, right? This is all similar. So these examples exemplify the concepts of energy or energy flow, and they are not unique in Ayurvedic practice. Just like languages, we have different names describing the same phenomenon. So that brings us to the second aspect, representing the individual human physiology, which is called doshas or VPK. This is also called as four humorisms or humors in Greek medicine. The three doshas in Ayurveda constitute the five natural forces, which is air, water, space, and fire. So air and space together function as vata, okay? You get this? Vata is nothing but flowing and motion, right? All the things that move, that make us move, that move in our body, right? Peristalsis or nervous system impulses, cardiac impulses, and so on. Fire and water manifests as pitta, which is digestion or burning. So chemicals, so gastric juice, liver producing bile, the brain trying to metabolize thoughts, right? And so on. And finally, water and earth function as kapha, which is lubrication or groundedness or resting. So things that are heavy in nature, muscle, like fat, the build of the body, the structure of our body, oil, lubrication in the joints, being very generous, very grounded to the earth, right? In short, VPK, I have coined the terminology move, digest, and rest, VPK. Based on the ancestral blueprint, which is genetic makeup of your ancestors and your parents and you, and the epigenetic influences of the environment, each human being actually has a unique combo or proportion of these three endotypes called Vata, Pitta, Kapha that forms your body constitution. You are a combination of these three things. And if there is one takeaway message from today's podcast, it would be for each one of us to know what our VPK dosha profile is. It's available online. And the reason is because this knowledge underlies all preventative, balancing, healthful activities that Ayurveda gives you, or all of these ancient medicine forms gives you, and all diagnostic and therapeutic measures that we offer in Ayurveda are underlying this VPK. Finally, the third thing is ojas and ama. The complete combustion or digestion of energy by an individual person produces a substance called ojas that promotes vitality, health, and reverse aging. People have been trying to figure out what this ultimate product of metabolism, if everything goes well, is. Some people think it is ATP, some people think it is coenzyme Q, and so on. So incomplete digestion or metabolism of any energy, be it mental trauma, if you have not metabolized this energy completely, if you have left things unattended, right? Old food, liquids, or antigens in the air, if you don't metabolize that very well, that leads to a production of substance called ama or toxic waste. That leads to aging, symptoms, and chronic disease, right? Each VPK phenotype of individuals will have to choose the appropriate phenotype of the energy that they want so that they can manufacture vitality rather than toxins. And that goes, again, based on trying to match Vata with the other two, and vice versa. This is where we go wrong as humans due to lack of knowledge or discipline, because usually Vata people are super tempted towards more Vata. Similarly, Pitta people are tempted more towards Pitta. Classic examples of VPK phenotypes. Example, famous people, Vata would be Audrey Hepburn, Michael Jackson. Pitta people would be Steve Jobs, perfect example, and John F. Kennedy, president. And Kapha people would be somebody like a famous personality like Oprah, right? So in general, right? So for example, for the same disease, such as asthma or COPD in two different individuals, therapy will be different for the one with Kapha phenotype as against a Pitta phenotype. Although certain diseases are more common in certain phenotypes, still you can have diseases. Being a Kapha phenotype, you can still have a Pitta related abnormality. In general, the rule of balancing opposites, yin and yang, operates very well in Ayurveda, similar to Chinese medicine. And yes, right, we do see the concept of Vata very similar to Chinese medicine practice. The idea of maintaining balance within the system through behavioral changes and nutritional supplement use are important concepts of TCM as well. One basic understanding is that the body system can be diagnosed as being hot or cold. And as such, certain foods should be consumed according to the status of your body constitution. If your body is primarily hot or Pitta, then more of cooling food supplements, not cold, cooling foods supplements should be consumed and vice versa. This practice requires a more in-depth analysis of the system rather than simple fixing of a symptom or a problem. Because of the focus of the holistic and comprehensive system assessment in Ayurveda or TCM, the practice may seem foreign to practitioners in Western medicine, where the focus is more towards addressing the symptom or problem one at a time. Right, great points. And this is important to note here that Tanya uses the word cooling rather than cold, because the nature of the food or activity that is cooling actually cools down the body's physiology to maintain homeostasis. And this does not refer to the temperature of the food, because usually cold foods are actually clogging and they don't help metabolize, right? Because you may have heard about micelles forming when you eat heavy foods and you have cold water. That's why Chinese people drink hot tea with everything. And if there's one thing that you can learn from this lecture, that if there's one thing you can take home, hot water sipping all day, just focus on hot water or warm water, you will find a balance towards your health. For instance, cooling nature of coconut water and melons, right? That's different compared to detrimental effects of ice cold water or beverages. Even if it's summertime, it's better to drink things that are normal room temperature, but more cooling in nature. So in summary, I would like to end this podcast with a sequence or flowchart. Energy comes in contact with a person and is processed by the human body-mind complex called dosha VPK. And depending on whether the VPK are in synchrony with the type of energy that you choose, you end up deciding whether you want to make vitality or you want to make toxins leading to disease. And the homework for each one of us here is to learn more about VPK, Vata, Pitta, Kapha, or move, digest, rest, and see if it makes sense in your own life. Well, I am extremely happy that you guys were able to join for this lecture. I will see you in the next video. And please feel free to message if you have any questions. Thank you very much.